What I've done here is I've compiled a list of conditions, not that we treat conditions, of course, that has been published in either anything from a case study to a actually controlled trial with some documentation that's, of course, in the book. And here's a list of all these here. Some of them are just case studies, right? At least it's documented that somebody was helped. Somebody was helped with upper cervical care in that condition here. But, autism, obviously we know who this is, right? And she's going around the world telling everybody, Jenny, about what vaccinations have done to her child. And but what many of you may not know is that the study Dr. Grostic did back, this of course was published after he died, but it was a great study on children that were helped with Grostic upper cervical care and autism. Here's a study by the Sweat Organization. Dr. Roy Sweat's group looked at upper cervical versus full spine care. And this was a really good study because it was a randomized controlled trial where they compared upper cervical atlas orthogonal work with full spine care. And guess who kicked butt? Upper cervical. Pretty cool. Pretty cool. And listen, I'm not one of these that's like, it's upper cervical and the rest of the chiropractors in the world are just trash. I'm not about that. It's not that in order for us to be right, they have to be wrong. Okay? I wish they would leave this cervical spine to us, because I'm not so crazy about gross manipulation in that area. But you know what? Listen, it's just as ignorant to say that I'm upper cervical doctor, I'm better than you, upper cervical doctor. It's the same ignorant to say that as an upper cervical doctor, I'm good and a regular chiropractor is trash. That's equally ignorant. It's ignorant. What else has been published? Infantile colic, Meniere's disease, mental disorders, multiple sclerosis, nocturnal enuresis, optalgia otitis, Parkinson's disease, pulmonary function, reflex sympathetic dystrophy, Sherman's disease, sleep disorders, stomach problems, tinnitus, vertigo, Tourette syndrome, trigeminal neuralgia, visual acuity. Y'all know about all this stuff? Here's a study that Dr. Bo Rochester, myself, and Dr. Charles Studley provided the patients in this, and it was a pilot study. But the thing that's cool, we used the Beck Depression Inventory, and we found that 73% of the patients experienced marked improvement in depression. Okay? Again, we talked about how blood pressure medication is the most highly prescribed drug in the world. What about antidepressants, anti-anxiety drugs? That's way up there too, isn't it? Okay? Again, we can't make firm conclusions. It's just a pilot study. But the PhD that did the study told us that the results that we got were better than drug trials. Again, what did we just show with the hypertension study? The results we're getting is equivalent to taking 2 different blood pressure medications. Here's the results on that. The thing that's sad is that the patient in my practice that I got the greatest results, I had a change of, I think, like 24 or 30 points on the Beck Depression Index. Actually, I got the data and I went to send it in and he had cut off the data collection. So she didn't get in there. And she had the greatest change. So we talked about the depression study. These both people need help too. They go to medical doctor and that's all they're getting there. And what can we do? But back to the Backer study. Of course, it was on WebMD. And I think a very interesting statement from Dr. Backers was this. When the statisticians brought me the data, I actually didn't believe it. It was way too good to be true, Backer says. The statistician said, I don't believe it. I don't even believe it. But we checked for everything, and there it was. I'm like, can you believe this stuff? Man. So pretty cool. Folks, we can explain this in a non-controversial manner. As a matter of fact, did y'all see the Harvard newsletter that talked about the Backer study? And in there, the medical writer in the Harvard newsletter, they say, how do you know if someone's atlas is out of alignment? Did y'all read that? You do a leg length check. They said it in the Harvard medical newsletter. That's how you determine it. You do a leg check, and that tells you. So I think that's kind of interesting. This is the study on the leg check reliability. I was in this study. Who else was in this? This is at the upper cervical spine conference. This is on the reliability. I don't know whoever else was in. I know you were in the other study. You were in that study? Yeah. We had, I think, 9 doctors in this study, and we got tremendous results. We had a core lifting coefficient of greater than 0.9. That's awesome. Folks, this is a study I published last year on lead-full filters, okay? Now, long story short, I used a physicist from the Alabama Department of Public Health, came down to my office and used the dosimetric reading devices to determine that my magnesium filter, on average, reduces 65% of the radiation. Not talking about the area that the filter reduces, talking about the overall exposure to the film, 65%. I even use a lateral cervical filter on many cases. This reduces exposure by 75%. The Vertex filter reduces it by 78%. Now, why did he do that? He did this free of charge, by the way. His mother travels an hour to see me. When she first came to me about 5 or 6 years ago, she had 4 ruptured discs in her neck. 4. And I told her up front I did not know if I could help her. But I kid you not, Beverly was here, she would tell you the same darn thing. Since that time, she's come to me and had 2 visits where she has had any kind of significant complaint in her neck or upper back. 1 adjustment, and she completely changed. This study, what about aspirin? What about aspirin? Now, you got to take aspirin to thin your blood, right? All the medical doctors are telling you, you got to take the aspirin. But here's what just came out here recently, or last year, that the routine use of taking aspirin for helping people prevent heart problems cannot be supported. This is now coming out in the medical literature. This is in the news here. And they're talking about here, the findings suggest that you should not take aspirin because the risks of bleeding may outweigh the benefits. How many medical doctors are subscribing to that idea? What's another risk of taking aspirin? The worst cancer you probably can possibly get, and that's pancreatic cancer. This came out in CNN a few years ago. Pancreatic cancer affects 31,000 people. Basically kills everybody within 3 years. Terrible, terrible disease. Look what they found here. They looked at nurses that regularly took aspirin. And they looked at the increased, look at this, 86% greater risk of developing pancreatic cancer if they regularly took aspirin. But why are they taking the aspirin, folks? Listen to this. The women using most aspirin took them for headaches or other aches and pains. Should not some of those women or all those women be in a chiropractor's office instead of taking aspirin? I ask you. Aspirin increases your risk of Crohn's disease 5-fold. 5-fold. They looked at 200,000 healthy volunteers. This was published at the Digestive Disease Week conference here. Another one of my chiropractic heroes, by the way. And you know what? What he and I do are quite a bit different, quite frankly. But that's okay. It's okay to agree to disagree. That's how professionals act. That's what they do in the medical profession. They do that all the time. They disagree and but they keep it in-house. What do? We go and publish it, in all these rags. It's like Dr. Grostic says, we circle the wagons and shoot in. We got to get past that.